and Education Committee. We'll begin by reading the electronic meeting statement. This meeting of the Health and Education Committee is being conducted electronically pursuant to Governor Bill Lee's Executive Order 16. I would ask for a motion that conducting the meeting electronically is necessary to protect the public health, safety, and welfare in light of the coronavirus. Do we have a motion?
So moved, Madam Chairman.
Second.
All right. Rachel, did you get your first and seconds?
I did, yes, ma'am.
Okay. Would you call the roll for us?
Commissioner Cook? Yes. Mr. Blair?
Yes.
Mr. Key?
Yes.
Mr. Gammon?
Yes.
Mr. Gorley?
Yes.
Mr. Phillips?
Yes.
Chairman Allen?
Yes. Thank you. All right. Our next item up is the Health Department report. Ms. Shan, Dr. McDonald, welcome.
Thank you for having us. Mayor Ketron, Madam Chairman and Commissioners of the committee, good evening. Tonight, I will be presenting the Health Department report of community health education outreach and COVID-19 updates along with Dr. Laura McDonald, who will talk briefly about COVID-19 as well. At this time, please take a look at the December 2020 report of community health outreach. Once again, for my fourth time reporting, these columns have not really changed much, labeled promote, protect, and improve, as our staff continues to work hard to ensure that we test and vaccinate and provide education and guidance to our community to help mitigate the spread of COVID-19 in our county. Moving forward to our COVID-19 updates. So testing continues. We continue to offer drive-through testing at our new State Farm site. Thanks to many of you all and Mayor for having this site for us to be provided vaccinations and testing, located at 2500 Memorial Boulevard, at no charge to anyone who wishes to be tested. Our drive-through testing is on Tuesdays and Thursdays from 8:30 a.m. to 10:30 a.m. Once again, tests are free without restrictions. We are continuing doing the oral pharyngeal swabs and continue to work all investigation of public health that goes along with our positive cases and contacts 7 days a week. On Mondays, Wednesdays, and Fridays for adults from 8:30 to 10:30 a.m., we are offering the self-test kits, which is the Everlywell self-test kit. These test results may be available within 72 hours of arrival to the lab, depending on the volume of test lab received. On these days, the public health member will help provide the self-test to individuals in our county who are needing these tests to be samples to be completed, as well as the paperwork. The health department will submit all samples for testing, and participants will register online. The self-test kits are only approved for those ages of 18 years of age and older, so not for children. Children and adults, however, are able to come on Tuesdays and Thursdays to receive the oral pharyngeal swabs from 8:30 to 10:30 a.m. As far as our vaccination efforts, we have, since December the 21st, roughly given out about 6,000 doses of vaccine. That is both first and second shots. Our second shot started this past week, and so we are well into our second vaccination. Remember, we are currently doing both Moderna and Pfizer vaccines. Moderna is 28 days apart, and Pfizer is 21 days for second dose, plus or minus 4 days. We are continuing to also look at our phases. So our local health department is moving through our phases based on the vaccine distribution, which is allocated to our county. So right now, we currently do remain in the 1A1, 1A2, and 75 years of plus. So the 1A1 is inpatient and other high exposed healthcare workers, residents and staff of long-term care facilities, and first responders. And then 1A2 is all other healthcare workers. If you or someone falls into the current phase of population and would like to place your name on the priority list to receive a vaccine as soon as the vaccine becomes available, we're asking for individuals to call 866-442-5301. Once again, that number is 866-442-5301 if you fall into that current phase. So by placing your name on this priority list, you will receive an appointment for as soon as more vaccine becomes available. Appointments will not be made for anyone who does not fall or meet the current criteria. Once again, here in Rutherford County, we're in phase 1A1, 1A2, and 75 years of age and older. Tennesseans can also follow 3 simple steps when they want to learn more about the eligibility. You can find your phase to find out which vaccination each county is falling into, as well as registering for the vaccination appointment. This information is available on the Rutherford County Health Department's website, as well as the Rutherford County government's website. The COVID-19 vaccines currently requires 2 doses for the best protection against the virus, and people who receive their first dose of COVID-19 vaccine at the local health department will be contacted to make an appointment to receive their second dose of vaccine. We have actually also moved to a QR code, so once you receive your first vaccine, we'll go ahead and get you signed up for your second vaccine, so someone doesn't have to contact you, but you will also know what day that you'll be coming back in for your second dose. As a reminder, the COVID-19 vaccine supply is still limited, and Tennessee counties may progress through the COVID-19 vaccination phases at different times, depending on the supplies of COVID-19 vaccines. So the Tennessee's county health departments will announce additional opportunities for residents to receive vaccinations as vaccination supplies become available and the county moves to new phases with the vaccination plan. We've been working alongside with our public information officers across our county, as well as Ashley McDonald, who's been spearheading it to get education and information out to let people know about those vaccination phases. Additionally, we will be working alongside with our senior centers, our churches, to get information out once phases begin to open up more. Those who may have general questions about COVID-19 can call the COVID-19 public information line between 10 a.m. and 8 p.m. Monday through Friday, and then 10 a.m. and 4 p.m. Saturday through Sunday. That general questions number is 877-857-2945. Again, 877-857-2945. As a reminder, we do remind all of our residents here in our county that in addition to the vaccination, wearing a face mask, maintaining social distancing, and getting tested when exposed or sick are critical to controlling the pandemic. Also, I ask that everyone please take a look at our new updated COVID-19 vaccination plan, which is also available on our website. I want to thank each and every one of you all on this call and also our residents for your patience and understanding. We will work quickly as possible to provide vaccines to Tennesseans and especially to our residents here in Rutherford County according to the phase-based approach and set out in our state's plan. As vaccine supply becomes more increasingly available, we will look forward to accelerating this process to get the maximum number of vaccines administered in the shortest amount of time. At this time, I'm going to open it up for any questions, but then also allow Dr. McDonald to talk briefly about COVID-19 and Pfizer and Moderna, and any questions that you may have in regards to those 2 particular vaccines that we're administering currently.
Madam Chairman?
Yes, go ahead, Commissioner Gurley.
Yes, I have a couple of questions or comments that these are things that I have received from constituents, mainly elderly constituents. One is they would like to see more information put on Channel 19, such as a weekly update on which phase what group we're giving the vaccines to, and so on a weekly basis. They watch Channel 19, but they don't necessarily, some of these people don't have a computer and it's a catch-22. Unfortunately, some of their resources, such as senior centers, the library, et cetera, where they would go for public access to a computer, are shut down and are no longer become available to them. So that's one thing. The other thing is, and this is not necessarily just for you, but maybe to the mayor and other members of the committee and so on, from seniors, is getting seniors there. If they do get signed up to get vaccine, some of these people can't drive or don't have access to a vehicle. I know Upper Cumberland, are we partnering with any of these other agencies to get people to the vaccination center when it's time for them to get it?
So to answer your last question, this week I actually received an email in regards to that. And so we will be working alongside with some of those transportation agencies to see about getting our, not only our 70 plus, but then also individuals who may have difficulties getting to the locations and places that we're going to be at. So we will be having those conversations here soon. And once we get that information out, get everything updated, we'll make sure the information is disseminated out. But I do love your idea of having that on channel 19 and updating it weekly. We're currently updating it weekly on our website, but I think it'll be a great addition to have it in more places. So if you all can think of any other locations that we can put it in, by all means, send me an email or give me a phone call, and we'll look at getting this information put in many places as possible so that we can make sure that our residents are well informed of what phases that we're currently in.
Yes, having had a computer since 1980, I was just a little bit surprised. But, you know, just a lot of people don't have a computer or don't know how to use a computer or don't have internet capability to utilize a computer. So that's something that was made aware to me, and I just wanted to pass it along. Thank you.
Okay. Well, Shan, along those lines, kind of as a follow-up, I know you're working with Ashley. We should probably, whatever, if you have graphics or anything that's ready to roll on Channel 19, I'm sure probably the local municipalities would run it on their local stations as well. So that way we're getting it on, Channel 3, whatever the channel is in Murfreesboro, hit all the municipalities as well. That way everybody's getting the same message.
Yes, ma'am. I will definitely make sure that we get that to her to get out to the other public information officers so that they can be disseminated. And we are updating our graphics weekly to show people what phase they were in, and if any changes have been made throughout the week as well, kind of updating them on that, and then providing them with the link to the most recent plan, which of course we know that the state plan is a fluid document, so it's ever changing and ever evolving. If you all were privy to the information that was disseminated, I believe at the beginning or end of last week, some of the counties are moving to the 70 to 74 phases. We are not quite there yet. We have a lot still that we need to be able to administer first doses to in that 1A1, 1A2, and 75. But as we get through these lists that we currently have, the waiting list that we currently have, we will then move into those phases. And I think this would be a great opportunity to have that on those local channels. So we will definitely look forward to doing that as well. So thank you.
Great.
Chairman,
Yes, Commissioner Blair.
if supplies become available soon, will you continue with the present distribution center or system, or will that widen out to maybe some of the outpatient clinics? I'm just wondering if supplies do increase, how can we increase the amount of inoculations?
Yes, so we do plan to have more distribution sites. Of course, right now, I believe we are the main source of vaccinations sites here in our county. I know that Ascension has started to also do some vaccinations to some of their patients. And so our plan is to have these conversations with Ascension St. Thomas and also Stonecrest, as well as there's been conversations with our Kroger pharmacies to be able to administer. And then, as you all know, there's a partnership with the federal government, with the CVSs and Walgreens and things of that nature to administer. So as we know, that as soon as we start to receive additional vaccine and know that we're going to have a good supply available, we do plan to partner to make sure that we can get more vaccine, especially to the north end of the county, and having somewhere down there, because we know that most of our vaccination efforts and things have taken place here in Murfreesboro, but we do realize that Rutherford County is larger than just Murfreesboro.
Thank you.
Well, Shan, I have a couple of questions from constituents that have asked me. The first one is, there was a rumor going around that we were throwing out doses at the end of the day. Can you address that? I know that's not the case, so can you address that?
Yes, and I think Dr. Mack is going to take that because I know she has been there, but I also get the reports, and I can say that is false reports that have been given out. So I'll let Dr. Mack speak a little bit more on the vaccine allocation.
Yes, towards the end of our vaccination day, we spend a lot of time out. It's by appointment, so we know how many people, for the most part, are coming. Every once in a while, we have people that have agreed to come and don't show. So we're very careful about, as you know, both of the vaccines are a little bit different, but they have to be thought out and drawn up, and then you have X amount of time depending on which one to inject. So we spend a lot of time out there counting people in cars and making sure. And some days, I'm proud to say we are right on the money. Some days we have maybe 1 or 2 left. And today I think we had 7 left, but we have a wait list of age-appropriate people that have agreed to answer the phone immediately at the designated time. And today when I got back over here from State Farm, they were almost all done. All 7 that were all done. And we have people, they have to be able to come right away, and they do come. And that's worked very well. So I've not seen one vaccine disposed.
Excellent.
We are like the world's cheapest vaccine givers. I'm telling you.
Yeah.
So we're proud of that.
Like I said, I knew I knew the answer to that, but I just wanted you to address it. The other question I've had from constituents is, are we only vaccinating Rutherford County residents?
No, there's no, no, we're not taking passports, license plates, or otherwise. Like I know other states are. Florida, you have to be a Florida resident to be done in Florida. But we've seen people from, local counties. The majority of them are on a license plate watcher out there, and the majority of them are Rutherford. There is a few, Bedfords. And of course, they have folks in that age group and there's just no vaccine availability there, and it's important for them to come. I don't see anybody abusing it. We're not getting overwhelmed. People are very orderly and very polite. It's been nice. No one's been hit by a car.
Yeah.
No one's hit each other. So far, so good.
Awesome.
Madam Chairman, we found out today that we've had constituents from Rutherford County go to Woodbury because they don't have the same population requirements and they have extra vaccines. And so people are going wherever they can get it. And that's what we need to be doing. We don't need to be hoarding these. They need to be going in people's arms wherever you can get them, as quick as possible.
No, I completely agree. Very good. I'm glad it's working out.
Madam Chairman,
Yes, sir. Commissioner Hammond.
I just want to commend the ladies and everybody that was involved. I went yesterday and got my vaccine. The Pfizer is the one that I got, and got a real sore arm now, about 8 hours later. But I just wanted to let them know everything was really. My appointment was 8:30 or 8:45, and I was clocked in back at work by 9:45.
Wow.
And it was a smooth old machine there. I just want to let them know.
I mean, we've learned several things to make things more efficient. It's like anything. This is our first, this is the first time we've kind of done this. When we had both vaccines going, we color coded the sheets. We make sure people are directing people into the right line. Like today, we had first-time Pfizers, first-time Modernas, and second-time Modernas. So you have to make sure you know who's getting what and when, and the paperwork's filled out properly. We've got our health department people on site in the big trailer there, and they're immediately entering all of that data into our immunization database so that every time, at the end of the day, everybody that's been done is in that database.
Excellent.
We've had a few situations where people maybe are, I'm going to say this nicely, less than honest about when they got their vaccine, but we can check that. And we have had to say, that's not cool what you just did, and no, you can't have a vaccine early. But, I'd say 99.99% of the people are totally doing everything the way they should do it. And we can get them through pretty quickly, and if they have had reactions to anything, we hold them. We watched them for 30 minutes. I had 3 people that had slight reactions to the first ones that we held closer to the actual drive-through area so I could go back and forth to them to make sure they were okay, and they all did great.
Awesome.
We had no significant adverse effects from Moderna at all. Sore arms is the big one. Some people have some low-grade fevers and they feel pretty tired. I think we all felt that on the weekend when we got our second one. Saturday wasn't a great day. Sunday we were back to normal, and I think that's pretty much across all age groups what we're seeing.
Excellent.
We haven't had any. We're ready if there's an issue. We've got EMS there. We've got us there. We've got lots of nurses around, and we're keeping an eye on them. but they're doing well. They're not an unruly crowd.
Commissioner Phillips, I think you had a good experience you want to share.
Yes, let me number one, back up what David just said, that I'm extremely proud of our health department and the way they've handled this process. I was in the Gulf Shores area last week and had an elderly, my wife's elderly aunt and uncle, close to 90 years old, and they've been calling a number for 3 weeks. They even had an opportunity to go into, it's in Mobile, Alabama, had an opportunity to go a time. They gave them a time, and when they got down there, all the vaccines were gone. So it's just a kind of a mess other places, and I'm really proud of what our health department is doing and getting all this out, and I can't emphasize that enough. You guys are true heroes to the citizens of the county, and we love you and we really appreciate everything that you've done. And let me also kind of back up what the doctor said a little bit earlier. I took my mother-in-law 2 weeks ago, and we were in and out inside of an hour, and that includes the 15 minutes sitting waiting for any type of reaction, which didn't happen. But when we got up to the front, I said, listen, I'm my mother-in-law's primary caregiver, and I know you're giving out some of those shots. Can you give me one? And the answer was a nice try, but no. So it went pretty cool, you guys. I'm really proud of you. So thank you for the job that you're doing. Let me ask this follow-up question. When I take my mother-in-law back as an example, and I know this is questions on some other folks' mind too, for her second dose, we already have the appointment set up. Do we just go through the same line?
Yep. And someone who was absolutely brilliant decided to put the number of people in the car that were getting zapped and whether they were an M or a P, and it was color coded. And I keep saying, can we put the little 1 or 2 on the bottom of the screen? Because the 2 is faster. I mean, people already have answered all the questions. We review it again. They're veterans of the process. And so it's in their arm and they go, yep, I know where to park. I'm out of here. I'll be 15 minutes. I mean, you don't even have to say anything. So I anticipate as we get to the point where we get the majority of people done and we're doing seconds, it will even be more efficient. That's worked pretty well.
Thank you very much.
Do you know, Dr. McDonald, how many you're giving an hour? I know the last time we talked, I think your goal was to do 90 an hour.
Oh, gosh.
So currently, we are doing about 30 every 15 minutes is what we're looking at. So that is
120, I'd say.
Awesome. That's awesome.
You know, if it's a car with, like yesterday, some of the caregivers or the nurses at Trust Point came through. And so they were having a party, by the way. There was like 4 or 5 of them in the car, and we just swarm them. Everybody takes one. It's not like one person does them all. Because we have enough people to do it, and we've got our RNs drawing up the vaccine and making sure. The only time we ever have to pause is if we have to wait for the time for the vaccine to be ready to be injected after we've thawed it. And that happens, and we tell them, and they're very fine with that. They're like, the reason you're all sitting here is that it's not quite ready to go in your arm. Nobody's been rude or complained, or everyone's been really nice. So that's worked well.
Well, I will echo what the other commissioners have said. I've only heard positive things about people's experience going through there. I know I've got a good friend who was eligible to get it, and she has a very complicated health history. She felt very taken care of. There was no concern at all. And so I know you're prepared for those tricky ones. And
they bring their list of medicines. I go through them with them. You know, a lot of people have allergies to other things. You know, and I just kind of go through their list and say that we've done tons of people that have had this kind of allergy and are on these medicines. Everything's going to be fine. And if they want to talk to us, we're happy to, because that's important that they feel, you know, comfortable.
There was also this concern. I think that a couple of people that I know they're kind of going through the forever vaccination that relates to shingles. And is there some type of complication that people need to be well aware of and not get those two mixed up or something?
Yeah, we don't like, well, I've had several people that, for example, I can give you one example. We ask if they've had any vaccinations in the last 14 days because we don't have the data to say it's okay to give this one if you've had something else. And they often answer no, but the LPNs that we have working for us are really good. And one of them said, I think you need to talk to this lady because she had tetanus and her daughter insisted tetanus wasn't a vaccine, which I explained it, if she was right, it's probably 2 vaccines or maybe even 3, depending on which one she got, because it has other stuff in it. And the mom was fine. She was an elderly lady. She was like fine with it. And we just don't want to, we don't know, we don't have the data to know how you could mix these vaccines. So the 14-day is kind of almost arbitrary, but people, for some reason, decide today's the vaccine day. We had one fellow that had his Hep A, his Hep B, something else, and then came for this. We were like, oh, Lord, no, we can't do it. And he was unhappy because his doctor said it would be fine.
Yeah.
And I had to inform him his doctor was a bit wrong, but we have to keep it clean because we don't want, if we have reactions, we got to know what it's from. And then we fill out the vaccination adverse effect form that we then submit to the CDC. So that's another thing we'll have to do if they do have and we've only done a couple, and they've been real mild. People that have had anaphylaxis in the past from multiple things, we keep an eye on them really carefully. And even if they have one lady had an immediate kind of swelling in a red spot, she was fine. We kept her for the half hour, but we still filled that out because we need that data.
Right.
The type of information, the questions and answering that we're having right now would be really, really good to put on Channel 19, as Commissioner Gurley said a little bit ago, because I know it's on some folks' minds. So if you can mentally remember what the questions we were asked and kind of answer those, I think it would go a long way in keeping people from being confused as to whether or not they may be in a position to take it.
Yeah, certainly the shingle shot is the one that most people seem to have gotten too close to this one.
Right.
I don't know. I just tell people just this is the one that's really important right now.
Right.
You can get your shingles anytime. So let's just, it just has to get out there. But I think the rumor is getting out there. We're seeing it less, that people have had other stuff. Very good. If they choose not to tell us, they choose not to tell us. But I think most people are being very honest.
Madam Chair, Deputy to the Mayor Sandlin stepped out, called Ashley, and said that she would talk with Lee about getting more information on Channel 19. And they will be updating as the state changes. That changes sometimes, LaShannon, as you know, sometimes 2 and 3 times a day. So they're on top of it. And she's going to push this out to all the PIOs throughout the Smyrna and Laverne, Eagleville, and City of Murfreesboro as well.
Awesome.
So there you go, Commissioner Gurley and Commissioner Phillips. We're on top of it.
Madam Chairman, this is for Dr. Dixon. Are we having any flu this day and time, or is it? I know
very little.
I know when I was in the hospital, they tested me for the virus, and I had the flu. And you don't hear of anyone having the flu. It's all the virus, and we do have flu.
We do. It's a lot less. And I think it's because of the social distancing, the masks, the hand washing, all the things that we do. We know from the Australians who've already lived through their winter that their flu season was almost nothing to mention. And they kind of have told us, like, you're going to have a light flu season. You will still see it, but we won't see it nearly in the numbers. And it'll be interesting. On average, about 3,500 people die of the flu a year in the U.S., and it'll be interesting to see what that number is. I bet you it's going to be really significantly less. We'll see.
I was fortunate enough to have a hotline to the health department when COVID visited my house. So will you go over for other folks who have someone positive in their household? will you kind of go over what the quarantine schedule is? Because I had to be educated on that myself.
Yes, so the COVID-19 schedule for quarantine and household contacts, of course, everything differs just a little bit in that versus you just being a contact. And there's also a contact of a contact. And so there's 3 different layers. We do have 4 individuals here in our health department who are assisting with these COVID-19 responsibilities when it comes to that. Let me pull it up so I can make sure I'm giving you the most up-to-date information. As Mayor Ketchum has alluded to, things with the state change very often. So I want to make sure that I do give you the correct information in sharing with you. And so looking at the Tennessee Department of Health does have this information available on the website. Once again, we know that this is not the end site of it, but we want to be able to make sure that we're providing this information. So we will make sure to get this on the Channel 19 as well. So if you have tested positive and are having symptoms, we do have a calculator on the Tennessee Department of Health website as well, which I think is amazing to have, because you have a calculator for your isolation, but then you also have a calculator if you are tested positive with no symptoms, and then also if you've been identified as a close contact. So if you have been identified as a close contact of someone diagnosed with COVID-19, you should quarantine for at least 14 days. If you live in that same household as someone with COVID-19, you should quarantine as long as you are exposed to the case and for an additional 14 days. So this could potentially take you out to 21 days plus, depending on how long you will be exposed to that person living in the house with you. But this is their last exposure to the case and then additional 14 days for your last exposure. So there are 2 also alternatives to quarantine timeline options that are provided from the Tennessee Department of Health, where you can have a shorter quarantine phase based off of if you get tested and receive a negative test result. That test result, I think you get tested on that 5th day, and then on that 8th day, then you're allowed to be released from quarantine if that test result does come back negative. But if you are someone that you know is exposed to COVID-19, there are immediate steps that you should take to protect yourself and those around you. So that's wearing your mask if you are in the house with someone who you've been exposed to. Of course, continue washing your hands, cleaning those frequently touched surfaces very often. So things that we don't think about, light fixtures, door handles, even, your kitchen area, because those are areas you're probably going to use. Also, if you have the opportunity and space to be able to do it in your home, having that person who is exposed or who has COVID-19 staying in one isolated location, such as a bedroom that has a bathroom attached to it, and not using the shared quarters as much. Also, that means, separating as much as you can from one another, taking their food to them and serving them their food outside the door, having them pick it up from there. And also you can utilize gloves if you have them as well. So there's a lot of different things that you can do to help protect yourself and that person who is sick. But the exposure time can vary, of course, based off of the first day that they were symptomatic. And then how long you will need to be quarantined as well will be based off of that information. So we do ask that you, if you have been exposed, please answer your phone because you probably will be receiving a phone call from someone with the Department of Health, if not our local health department, to kind of talk you through those steps. As well as, of course, if people have questions, they can feel free to call us here at the health department and someone will get back to them. But then also those information lines and information that I provide you with, they can call those numbers as well.
Well, I can tell all those steps. So far, nobody in my house has contracted it, God willing. And we're, I think I've lost track. I think we're on day 20 something now. So anyway, but thank you so much for the advice that you gave us, and hopefully others will heed it as well. So.
Yes, ma'am.
All right. Did anyone else have any questions for the health department before we vote on their report?
Just one follow-up, but I know that Mayor Ketchum has already asked this, and I'm pretty sure you have too, Chairman Allen. Is there anything that the health department needs from the commissioner or the mayor's office? Anything?
Everything that we have asked for, I can say we have truly received. And like I said, the mayor and his office has been tremendous asset to us, as well as Cody there with IT and Chris Clark with emergency management and all of our law enforcement agencies and EMA have provided assistance to us. And so we're very grateful to them for the continued support that they continue to give us on a daily basis, both here on site at our health department, but then our site in Smyrna, and then also at State Farm. One thing that I think people fail to realize is that through this pandemic, we are still operating our traditional services here at the health department. So while we're at State Farm with a lot of our staff, I'll say probably 80% of our staff, we also have the other 20% of our staff that's housed here at Smyrna, at Murfreesboro and Smyrna, that continues to offer our traditional services. So I want to also say thank you to our community for providing us with food almost every single day. We've been grateful to be fed. Food truly does nourish the soul, I would say, and our staff has been fed almost every single day because of the amazing partnerships that people have been able to form in the community. So we're very grateful to them. But as we continue on, we're really going to look forward to having more ways of communicating with our residents in the county. And I know that we have some up and coming things that are happening. One of those things, and I'll go ahead and kind of put it out there tonight. I think this is the first time that we've said it, is a call bank that we're going to have here locally, that people can be able to call a local number and talk to someone during those hours and get them signed up for second dose appointments, as well as answering any questions. So this will be rolling out here live, hopefully in the next 24 hours. So we're excited to have this going, and this is all thanks to our county IT department, because they have been a tremendous asset to us here locally to be able to, like I said, disseminate this information out, but also to have someone live that you can talk to over the phone instead of going to an email link and trying to find links on our Tennessee Department of Health or Health Department's website. So want to thank the mayor for all of his assistance and help with us here at the Health Department, and the continued support of each and every one of you all, because we definitely cannot do this alone at all.
Excellent. Thank you so much. So before you go, we need to vote on your report. So I'll entertain a motion for the report.
Second.
Okay. Rachel, you have what you need, your first and second?
Who was the first, please?
Jeff Phillips.
Okay, I'm sorry. Thank you.
Will you call the roll for us?
Yes, ma'am. Commissioner Key,
Yes.
Commissioner Gammon,
Yes.
Commissioner Gurley,
Yes.
Commissioner Cook,
Yes.
Commissioner Blair,
Yes.
Commissioner Phillips,
Yes.
Chairman Allen.
Yes. Very good. Thank you, ladies, and Godspeed. We appreciate you so much.
Thank you.
Thanks. Okay, next we have the community care report that's available for you to review on the SharePoint site.
Madam Chairman,
Yes.
may we do the minutes of the past meeting?
Thank you for keeping me on track. This is why we keep you around.
Thank you, ma'am.
I'll entertain a motion to approve the minutes for our past report, or the minutes from the past meeting.
Madam Chairman, if there's no objection, I move that we approve the minutes of the last meeting as presented.
Thank you. Do we have a second?
I'll second that.
Okay, Commissioner Gurley. Rachel?
Commissioner Phillips,
Yes.
Commissioner Gurley,
Yes.
Commissioner Gammon,
Yes.
Yes.
Commissioner Blair,
Yes.
Commissioner Cook,
Yes.
Chairman Allen.
Yes. Thank you very much, Commissioner Blair.
Yes, ma'am.
Okay, now let's move on to community care. That report is on the SharePoint site and on your iPads. I've had a chance to look over that, but if Mayor, if you or Carol have anything you'd like to share, we'd love to hear it.
Carol, any comments? Okay. Thank you, Madam Chairman, members of the committee. We met, the Community Care Board met last week. I executed the contract with United Church Homes. We have a new director of the nursing home. His name is David Zach. United Church Homes, I think maybe I shared with you last time, we were working with them on a contract. They have about 72 different homes. They have facilities on 2 different national Indian reservations. The closest one to here is in Crossville. They're out of Marion, Ohio. Mr. Zach will be working directly for them, but the Community Care Board will continue. It's a 3-year contract with a 1-year look-see after 12 months, whether we want to continue that contract, but the board will still continue. The employees still work for community care and have the opportunity to serve in state retirement and our county benefits. There's some exciting things happening. Even because COVID shut us down, if you recall, we had been able to get a Christy Houston grant to finish the old wing, which was the original wing from the nursing facility, and it stopped construction last spring. And so we began construction on that. I talked to Ann Davis with Christy Houston last night. She is mailing the first installment of that $650,000 check of the grant to us to help pay for the remodeling. It's a 50-50 grant, so the nursing home will pick up the other half. The other exciting opportunity we have is the board. I presented to them the opportunity to enhance our daycare. Our daycare, we're one of the few nursing facilities in the state that has a daycare, but we want to take it to the next level. And that next level is going 24/7. That will be a recruitment tool and a retention tool for all county employees. We sent out a survey. We had Sonia in HR send out a survey to all county employees. We're up to 342 respondents who said that they would use this type of 300 or 24/7 daycare. So that will help our second shift and our third shift for like the sheriff's department, our EMS employees. And we haven't even gotten to the schools, and we already got 300 folks who said that they would use that. But we don't have to buy property. We build the building. We're going to start out. We have engaged Johnson & Bailey Architecture here in town, who did the last remodel back in the 90s. So they'll be developing a building to go adjacent to and be right behind the current existing nursing facility. It'll be a covered walkway. We already have the kitchen and staff cooking 3 meals a day, so we'll be able to cook meals and bring to those children of our family children who are engaging in that. I had no idea what daycare costs today, but somebody have shared with me it's between $200 and $300 a week. So this could definitely turn into a profit center for our nursing facility, and what profit would roll right back into the 501c3 nursing home. So it's a great opportunity, and I think our board's excited about it, aren't they, Commissioner Cook? And giving that opportunity for all county employees to participate in this facility. We're checking to see if we're available for the second round of the PPP. We did receive the first one, but I think there's a percentage of how much you had to lose over the last so many months since we got the first check we got about $1.2 million on that first PPP. So we'll find out more about that, but that's kind of it in a nutshell. Any questions?
Explain to them the operation of the inside of the nursing home and the building.
Yeah, Commissioner Cook wanted me to explain what we have done. And of course, some of you may have seen that our numbers were, as published in the Daily News Journal, seem to be higher than the majority of other nursing facilities. We tried to tell the News Journal that it's not as bad as what it appears. The problem is that we're being very honest with our numbers. I'm not sure some others are. However, you have to go a certain number of days without a COVID incident before you start back to zero. And if you get to, I think it's 28 days, you get 28 days. And if you get to number 27 and one of your staff member comes in positive, then it just continues. You can't, you start all over again, and it just continues. So what the newspaper was doing was accumulating all of our days, which was taking us far, far back. And for some that we know that they've had more deaths and more cases, and they were showing they had 0 cases, which was not being truthful. But anyway, we don't have time to worry about what everybody else is doing, but we just wanted to set the record clear that our nursing facility is clean. We're doing all the right things. It's a great place. We have implemented the hug around. It's a plastic see-through screen that you can put your arms through. And so the patients can come up and stand or be in their wheelchair, and they can actually touch and feel, their family member. So we were excited to get those things purchased.
2 booths.
Yeah, we have 2 booths that they're able to do that and at least touch and talk, instead of outside the window on the outside of the building, or FaceTime on. We do have those where you can FaceTime on the iPads, but just to be able to, even though there's plastic, in between you, you're still able to touch and hug them and touch your face. It makes a big difference to our population out there. That concludes my story and my report.
And that's a big dose of medicine when you can hug your loved ones.
Very good. Were there any other questions for the report? I did have a couple I was just going to ask about. On the United Church Homes, I know we've contracted with them to provide the actual administrator. One of the notes in the report said that the AR large accounts receivable list was not presented, and it just made me wonder in terms of like from the business office standpoint, how is that going to work? I mean, these people are still our employees, but I think if I remember the contract correctly, the United Church Homes, they were going to receive a portion of that revenue that we generate. Is that correct?
That is correct, Chairman.
Okay, so I'm just curious how that relationship between the administrator, business office, how's all that piece going to work? Is that just something that the board's going to stay on top of? And
we will. Every month we will be getting reports from them, and so I think it's going to be a much better report than the 2 years that I've been as chairman. We come in and they just hand out papers, and nobody really tells us what is actually going on as far as the administration is concerned. This is what I've picked up, and I think you have as well, Commissioner Cook. It's very professionally run, and all we have to do is ask for the information. They're prepared to give that to us. They have an app that they use for their employees that our employees can download, and that will be their scheduling. It's a scheduling app, and so they'll be able to download it instead of having to get in the car and drive all the way back out there to find out on Friday when they post the schedule to find out what the next week is. They'll just be able to pull it up on their phone sitting around watching a football game, which is kind of cool. So we're excited about that, and any other purchasing we can piggyback on them, and they can piggyback on us as well. If we have a contract with the school boards to buy a lawnmower or washing machines, those type of things, we can utilize those same opportunities for purchasing items to hold our costs down.
I guess I was just particularly concerned about collections, because I know that's, that can make or break you in any organization. And so I just want to make sure that we were monitoring collections closely and making sure that all that billing was happening correctly.
We get a report every month, and we have been since I've been there, of what are outstanding accounts.
For whatever reason, he just didn't submit one last night.
Yeah, for whatever reason. Of course, he's only been there like 2 days from this last report of these minutes that were given. He did not give that report. But in my discussion with him today, he said things are coming together. He's beginning to find out more about who does what. We didn't even have an organizational tree, and they're helping us put together the formation of that organizational tree and who reports to who. So we think we're going to get a much better picture of our nursing facility.
Well, I knew that relationship came together pretty quickly, so there wasn't a lot of lead time for transition. So that's fine. When I saw that the AR list was not presented, it just stuck a little bell went off and said we need to make sure we ask about that.
The board has learned a lesson too. We have told them that the organization Uniting that they will be working under the board.
Okay.
They'll be working with us, and we're keeping a closer watch than what we've had before.
And the other thing I was going to ask about is on the daycare expansion. Have we run the numbers in terms of what it's going to cost us, not only for the expansion, but what the operational cost would be to move to a 24/7?
We're in the process of doing that. We just got approval from the board to move forward on that last week. So process, hopefully we'll have that maybe next month for you.
Okay, yeah, I would be really interested in seeing what that looks like, the operational cost for 24/7.
That's why we did the
Survey.
We did the survey. First, you got to know how many you want to build the building for, and then you equate that into, okay, at $200, or even if we make it more economical, that's what we would really like to do, come in at 175 or whatever. We can adjust those numbers, what we want to charge per week. Then we back into it and base it on what we can afford to build, the square footage from that standpoint, and what it costs to feed, et cetera. Architects are going down to Chattanooga. It's one of the few 24/7 facilities in the state of Tennessee. They're going to do a road trip and go down and gather a lot of information and bring back to the board this next meeting. So we can make that determination before we ever pull the trigger.
Well, but I clicked on the survey. It came through on my county email, and so I was looking through there. And some of the questions were things like, would you be interested in drop-in care, which is, that just means almost like a babysitter on call. Do you need transportation for your student to go, to and from school? And so it's things like that could having to provide transportation to pick kids up from school and bring them back. It's a lot, could potentially be a lot of money. So I just want to make sure that we're looking at the scope of the whole thing before we jump off into it.
Sonia's office put that together at my request. I didn't review those questions, and her staff put the questions out and then mailed it before I got a chance to look at it. And I said, well, transportation, you're getting into a whole nother step. So it's one bite at a time before we start busing and et cetera. So we were approached last year by Pillsbury, not by Pillsbury, but by United Way. Megan Flippin and the Boys and Girls Club had approached us because they said if you can't fill it with county employees, we stand prepared to come to you and contract with Pillsbury and Rich Products, those other industries in Rutherford County who are running second and third shifts that may be interested in the same thing as well.
Okay, so yeah, it just sounds like we're on the front end of doing the exploration. So I'll be interested to see more information that becomes available. Yeah. All right, I'll entertain a motion to accept the community care report.
Move to approve.
Second.
All right, Rachel.
Commissioner Gammon,
Yes.
Commissioner Key,
Yes.
Commissioner Gorley,
Yes.
Commissioner Phillips,
Yes.
Commissioner Blair,
Yes.
Commissioner Cook,
Yes.
Chairman Allen.
Yes, thank you. Okay, special projects. Is Miss Jelly there? I can't see.
I'm here. She's down here.
You have anything you want to share with us on this report?
I don't have anything to point out. If they have any questions, I can try to answer, but I'm just doing the figures. I don't really know that much about it.
I get you. We've had this report for a little while. Anybody have any questions about it? For those out there in the world that don't know, this is just us paying the bills, paying as we go. And she kind of keeps track of all the school capital projects and lets us know where we're at in terms of percentage of construction complete and expenditures. So pretty boring report. Thank goodness. We usually kind of know where we're at on these. So are there any questions for Ms. Jolly?
Move to approve the report, Madam Chairman.
Thank you.
Second.
Very good. Thank you, Rachel.
Commissioner Blair,
Yes.
Commissioner Key,
Yes.
Commissioner Cook,
Yes.
Commissioner Gammon,
Yes.
Commissioner Phillips,
Yes.
Commissioner Gorley,
Yes.
Chairman Allen.
Yes, thank you. All right, school board. I see Mr. Blotter is there. There he is.
Hello. We have one agenda item for y'all to consider tonight. Can you hear me?
Yes.
This item that I'm going to talk about tonight for your consideration, it has not gone before the school board yet. It will go to the school board this coming Thursday. Spoke with Coy Young, our board chair. He said, and as we talked about, I talked about my email, for the sake of getting this expedited, so there's not a lot of retroactive pay issues with my payroll folks and Lisa Nolan's payroll department, as well as just trying to get this into the employees' paychecks and the bus contractors' checks, if approved. If we could get this in front of you for consideration tonight, then we can have it, the school board will vote on Thursday, next Thursday night, and it can go on to the budget committee with y'all's approval. Is that something that can be looked at?
Yeah, with that objection, I believe that's correct. Yes.
Okay.
All right,
Okay, so
I
the-
have a question.
I'm
Yes,
sorry.
sir.
Yes, as I read the email, this is 100% state money, no local funds involved, correct?
It is state funds, and it's also ESSER 2, which is CARE Act funds, sir.
So state or
So-
federal?
That is correct. There is no local funds that we're talking about here tonight. If you want, I'll go through this amendment.
That'd be great. Thank you.
Okay, this budget amendment is to budget for a 2% non-recurring pay raise for the Rutherford County Schools certified and classified employees, as well as a 2% non-recurring increase in Rutherford County School bus contractor payments. The time period for this 2% non-recurring employee pay bus contractor increase will be as follows. Number one, salaried employees will be for the second half of the 2021 fiscal year. Two, hourly employees will be for all pay reporting periods beginning after January 1, 2021 and ending June 30th, 2021. And three, bus contractor payment increase will be reflected on invoice payments for the months of January 2021 through June 2021. The funding for this 2% temporary non-recurring pay increase will be provided from $1,330,831 in federal ESSER 2 grant funds, as well as a one-time increase of $1,770,000 in additional state BP funds approved by the State General Assembly in a special called session last week. This increase will be calculated for RCS employees on base pay per school board approved salary schedules, excluding supplemental pays. The increase for bus contractors will be calculated on the monthly seat rate and mileage total for the invoice payments for the months of January 21 through June of 21. To be eligible for this non-recurring pay increase, individuals must be active employees or bus contractors as of the February 11th, 2021 County Commission meeting when this budget amendment is set forth for consideration. It should be noted that the State General Assembly will be considering a permanent recurring pay increase for school certified positions in their upcoming regular legislative session. What this is the State General Assembly approved for what they termed a 2% non-recurring pay increase. And of course, they would fund that for BP positions. And we thought, okay, well, we would also want to provide with ESSER funds, CARE Act funds, a one-time same increase for our support personnel and our bus contractors. Checked with the federal folks, and they said that isn't allowable since it's a non-recurring expense. All of our folks are doing extra work because of COVID. They said that is an allowable expense for those COVID funds. So the recommended motion would be to obviously approve the proposed amendment for this one-time non-recurring pay increase as presented.
So moved.
Very good.
Second.
Very good. Thank you. Rachel?
Wait just a second. I've got a question, if you don't mind.
Yes.
This all sounds pretty good, but why are they doing this? What is this really for? Why are we doing this, Doug?
You're asking for the state general assembly reason, sir?
Why are they doing that? Why are we doing it? What's behind this?
It's last year, the Governor Lee, he had presented before COVID hit, a 2% raise for the employees, the certified employees. And of course, that was placed on hold when COVID hit. So the employees did not receive a pay increase. We know their insurance went up. And so the governor wanted to try to make whole on that. And so when that came in, that's the reason.
Perfect answer. Thank you, Doug.
Yes, sir.
Okay. Any other questions or discussion? Okay, Rachel?
Commissioner Phillips,
Yes.
Commissioner Gammon,
Yes.
Commissioner Cook,
Yes.
Commissioner Blair,
Yes.
Commissioner Key,
Yes.
Commissioner Gurley,
Yes.
Chairman Allen.
Yes. Very good. Thank you, Doug.
Thank you. Do you have anything else for me?
Anybody
Doug,
else?
I had a question. I think if I'm not mistaken, Public Safety Committee deals with OSHA every month. And back in November, there were some questions that came up that related to accident investigations within the school system. And I understand that you guys have your own system, and I don't want you to go in that tonight. It's been a lengthy meeting as it already is. But at some point in time over the next couple of months, if you would be prepared to explain to this committee what you do when you have an accident, how that accident is investigated, and the process that you put in place to correct any unsafe conditions and take certain actions to see that same type of accident doesn't happen to the same person or others. If you could do that for us over the next couple of months, we would follow up with what the public safety was asking the Health and Ed Committee to do.
Yes, sir.
Very good. Thank you.
Very good. All right. Is there any other business to come before this committee? If not, we are adjourned. Stay safe, everyone.
Thank you.